Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thank you for tuning in to the latest edition of the Checkup. Although there's been some progress in recent weeks, we know that vaccine hesitancy continues to be a major problem in the ongoing effort to get shots in arms and for the nation really to reach that herd immunity we're talking about from the COVID-19 pandemic. In March, Trinity Health, a large Catholic health system operating in 22 states, launched a $1.6 million vaccine education campaign that was largely centered on communities of color. I'm pleased today to welcome Dr. Daniel Roth. He's Executive Vice President and Chief Clinical Officer at Trinity. We're going to talk about that education campaign and also ways that providers can continue to promote the vaccinations. Dan, thanks so much for being with us on I'm sure what's a busy time for you.
Matthew, it's great to be with you. Thanks for having me.
So let's start first, leading into March, where you launched this large, $1.6 million campaign. Talk a little bit about the background of that and how Trinity decided to put that amount of money to a program like this.
Yes, it's a great question, and as you note, it goes back a few months even prior to March, and so we have a commitment, right? It's part of our mission, part of our values about caring for people in our communities and making sure people that are don't have access to care all the time and are impacted by social needs and have disparities, and how do we address those? And so that's been something that we carried into the pandemic. And certainly last year, it became clear to all of us that the pandemic was having a disproportionate impact on people of color and in people who are under-resourced. And we saw that with increasing case rates and increasing mortality in people in Black and Latinx communities. And so as we did our vaccine planning, even toward the end of calendar year 2020, we knew this was going to have to be an important part of what we were doing. We were aware of the increased hesitancy, particularly in communities of color, and we knew that was going to be a barrier. And so we started even in December working toward a plan to be able to do that. And so that was bringing together our marketing and communications teams, along with our community health and diversity and inclusion teams, to think of the best ways that we can actually address the hesitancy, and really, because it is the way we will end the pandemic, and to make sure that we don't carry those disparities through the vaccine process.
And so we're a couple months into it. What kind of results have you been seeing from the education campaign?
We've been seeing good results, and so I think there's really two parts to that $1.6 million you mentioned. One is creating an education campaign that we call It Starts Here, and that is social media, communication materials that we're using in all of our communities, but also with the focus on 14 communities, which are representative of greater than 40% of people of color. Another $1.1 million of that was really to create partnerships with people in our communities and agencies and community groups who would help us to carry that message through and really do a couple of things. One is to get that message down. We know that this is a local endeavor, and we need to reach and partner with local people. So how do we find people who can be of influence and use those materials for good? How also do we make vaccine accessible? And so we want to make sure that people have access to the vaccine. It's one thing to have a call to action. It's another thing to be able to say, yep, I can get the vaccine, because at the end of the day, what really matters the most is seeing that vaccine number go up. And I would say this to your question, we have certainly seen uptake on the message. We've seen the messages get replayed. We've seen the influencers have an impact that we had hoped. We've also seen both internally and nationally increased acceptance of the vaccine and reduced hesitancy in communities of color. And we take that as great news. But ultimately, we know that what really matters is people getting vaccinated. And so while we've seen improvements, and we've certainly are pleased to see people getting vaccinated every day, we know we still have work to do.
Yeah. Dan, how did you target those 14 communities you referenced? How did you pick those communities as the one that you were really going to zero in on?
So those are communities where greater than 40% of the people in the community are of color. So we really looked to, as part of our commitment to addressing diversity and inequities related to race and ethnicity, we really looked to communities where greater than 40% of people were non-white or Black or Latinx.
And you talked about the idea of access, right, as well. So how much of this, now that we're seeing some reduction in hesitancy, how much of it is hesitancy and how much of it really is an access question?
It's both and, right? And I think the one thing we were talking about this morning as we sort of live into the J&J news from last week. And so if the one thing that the pandemic has taught us, it is that we will continue to evolve both in our knowledge and our actions. And so it's a both. I think in December, January, February, and March, it was really about education, and now it's more and more about access. And the good news is we now have supply, right? And so we're seeing, even in the last couple of weeks, an adequate amount of supply tip in where people now can get the vaccine, but now we have to make sure the vaccine is easy to get, particularly for people whose schedules are harder. Transportation is harder. And so that's where really we're committed to making sure that's not part of it, so that you don't have to drive, that the places where we offer the vaccine are on transportation routes for public transportation. We're getting out into communities, faith-based community agencies, churches. How do we make sure that we build those partnerships? And that's that second part that I mentioned earlier of how do we partner with community groups who can get the vaccine right down into the communities, into the neighborhoods where people are.
I want to touch on J&J in a second, but part of the new thing that we're seeing, I think, are people not returning for their second shot for Moderna and Pfizer. And I'm wondering if you're seeing that at Trinity, and if what you're trying to do to address that problem.
Yeah, we saw some of that data, and we saw the data that everybody saw about the 8%, right, over the weekend, and we've seen some of that. I don't think we've seen it to that degree in our data yet. It's a little challenging from a data perspective, but I think there's a number of reasons for that. I think one is we've always seen some of that in other vaccines that have multiple dose series, but I think it gets to this question about how do we make it easy for people that have frontline jobs, that don't have the schedule flexibility, that don't have the transportation access, is for certain part of the driver of that. And so we want to make sure that's a part of this particular program that we're addressing. The second, we know that as part of this is people are concerned about the side effects of the second doses. There's become, right, a lot of community communication about what does that second dose mean? Are those side effects going to be bad? Am I going to have to miss work? And so I think we also have an educational component we need to follow in on around making sure people understand the truth of that, what that means, what those side effects are like and what they're not. We want to be factual about it, but I think those are probably the three reasons why we've seen that second dose missing rate that we need to address. And gets to this ongoing notion, which is, when the pandemic's over and we don't know when, if that happens, we're going to be constantly trying to find and solve new problems. Right.
Well, that communication piece leads us into J&J as well. Mm-hmm. Now that states are administering the J&J vaccine again, have you started to talk to communities about that vaccine and whatever concerns people may have about the pause and now the restarting of it?
We have. And so we started that Thursday, Friday last week, and we even had conversations over the weekend. And we'll want to, over the course of the next few days, engage with our community partners about what that means for them as well, because we were relying on the Johnson & Johnson vaccines for certain communities where we knew second doses would be hard. But by the same token, we want to make sure that safety is a core value for us. And so we also want to make sure that people have full understanding of the risks and benefits of the vaccines now that we have a better understanding of the risks of the J&J vaccine. And so we are in the midst of that conversation, both internally within Trinity Health, but also with our community partners about how do we get the right vaccine to the right people at the right time, with the ultimate goal being that we want to get as many people vaccinated as we can, or we have to incorporate this new information.
Got it. One of the other things I'm curious about, Dan, is you think about reaching different populations. Some of the vaccine hesitancy, we're starting to see data now emerge that it's breaking along different demographic lines. Mm-hmm. So maybe party affiliation, rural versus urban. How are you factoring any of that into some of your outreach campaign? Because obviously some of it's the populations of color, but now we're seeing these other little subsets emerge as well.
Yeah, and we are mindful of that. And we're having conversations because we knew, right, even when we did the $1.6 million, right, in the first quarter of this calendar year, we knew that it wouldn't be the end and that we would evolve or pivot. So now we're in the middle of that. By the same token, we're still committed to making sure that communities that experience inequities and populations that are experiencing inequities are ones we're still committed to. So even as they see improvements in vaccine hesitancy and hopefully we continue to see improvements in vaccinations, we still know those underlying reasons as to why they've experienced the pandemic in a worse way exist, and addressing those social influencers and social needs remains a commitment of ours. And at the same time, to your point, we need to continue to look at, for the remaining 50%, 40% of the country that hasn't yet been vaccinated, why, and really proactively address those reasons. Yeah. Some of the reasons are the same. They're misinformation about the science and the truth of it, and how do we continue to address misinformation. We're always fascinated by the ability in today's world for social media to continue to propagate misinformation. And even we've learned as a country and at Trinity Health that social media even has a way of being different depending on how you associate. And so we're trying to think of ways we can then use that to get the right information in people's hands, because the worst thing that can happen, independent of party affiliation or race or ethnicity or rural versus ethnic, is that people make decisions on bad information. The other thing that we're working on, which we think will help in this next phase, is we know that all people, and this seems to break across multiple, is they trust their clinicians, they trust their physicians, their primary care physician. And so how do we then begin, as vaccine supply becomes more abundant in all those communities, to use our primary care physicians to help reach out to these patients, address whatever their concerns might be, because those are the people and those are the conversations we think that will help us at the next tranche of improving vaccination.
Yeah, it's interesting to bring that primary care piece up. I heard a report the other day of, some doctors talking about how their one-on-one relationship with a patient has made it easier to address vaccine hesitancy, as opposed to these mass vaccination sites that counties and cities have set up, which obviously are very important.
Yep.
But that one-on-one relationship becomes really important for the clinicians.
We think that's critical. And so we began this conversation just a few weeks ago. Yeah, you're right that in January and February, when we had demand greatly outstripping supply, the most important thing we could do, and cases being very high, the most important thing we do is getting as many shots in arms. And so that led us into mass vaccination sites, either within Trinity Health or through community partnerships. But I think now over the course of the next 60 days or so, that's exactly right. And we're beginning to see, okay, how can we get, now that we have ample supply of vaccine, into all of our practices, so that when a patient shows up and they can have that conversation with their provider, with their physician, with their primary care provider, and they say, I'm ready to get that vaccine, they can do it right then and there, because we think that will be a key lever we'll pull between now and the summer to reduce that vaccine hesitancy rate. Right.
And Dan, lastly, in the last couple minutes we have left, I want to pivot a little bit and talk about this from a leadership perspective. Trinity is a massive, Catholic health organization. You're operating in 22 states. Just talk us through that part of this puzzle, and how you, from a leadership standpoint, address some of the challenges you may have faced in terms of, rolling out the vaccine and getting your different states and everybody aligned with your priorities.
I think it goes back, and this even goes back to as we've confronted the pandemic, even from March of last year, right? As we just reflected on the year mark and now 13 months, is we start with our mission and our core values, right? They're who we are, and they really have helped us get through the pandemic in the best possible way, making sure that our commitment to safety and communities that are underserved and the poor and integrity. And so we continue to rely on those. They helped us get through the worst of the surges, and they helped us plan through the vaccination process. And so we really continue to use that as our grounding. And so that means that we want to make sure people are safe first and foremost, and that means getting vaccinated. But it also means that we're building up partnerships. We know that we won't solve community health by ourselves. As big as we are, we won't fix community health by ourselves. And so it's an opportunity for us to build those bridges that we had before the pandemic and to build new ones to get into communities across the country. And also to make sure that we leverage our role as a healthcare provider, right, that people trust to do that. And we continue to try to do that through the vaccine process, and we'll continue to do that hopefully over the coming months.
Well, great, Dan. I appreciate you taking some time today. We know it's extremely busy for you. We'd love to stay in touch as you continue with the education campaign, and maybe check back in with you in a couple months.
I appreciate it very much, and I would look forward to that.
Thanks so much. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.